This talk is about human behavior, and by understanding human behavior, how we could design tools, solutions for encouraging positive behaviors. My name is Yana Boyazu. I'm an independent design consultant, and I have been passionate about figuring out what drives people's behavior since a very long time. I'm normally based in Barcelona. At this moment, I'm talking to you from Kenya, and I work on international projects, mostly focused on design research and service design. So human behavior is a big part of my work. So let's take a moment to reflect upon the new strange world that we live in. Within 1 year, we have witnessed a huge change in human behavior globally. We have basically a new reality, new social norms, and we even say hello to each other in a new way using our fists, elbows, and so on. So a lot of new behaviors. And aside from behaviors aside, our habits have changed massively. So we have some habits that are less healthy than others. For example, blurring work balance by bringing the office in the home environment. On the other hand, we have a huge shift in how much we are aware of health and fitness because of lockdowns and the need to exercise, the need to eat more healthy food. So I have observed an overall proactive attitude. People making the best of out of their gardens, their balconies, their spaces to get the exercises that they need. And also very much more aware about the importance of mental health. So these are also all kind of positive new habits or new behaviors, if you like, that have come up. But if we think about the challenges yet to come, this has been just one of many, right? We have climate change, environmental challenges coming up. So, considering what the future might bring, I would like us to question ourselves and think how might we, as designers of new tools, of new technologies, encourage positive behaviors? Is this something that we could do to make the world a better place? So let's reflect on that for a moment. Something that we hear a lot about recently is design for behavior change. It's something related to or behavioral interventions. It's mostly related to healthcare and to environmental awareness, and it's behavior change is about being able to influence the attitude to change some fundamental bad habits. And by doing that, to encourage a better positive behavior. So if we look at different ways in which this is happening today, let's look at a couple of examples. The first example would be like we should encourage positive behavior by defining what people are allowed to do and what not, for example. Now, what's the problem with that? Sometimes rules and restrictions might actually cause the opposite side effect of the intended behavior. So, if we look at this picture, for example, you see on the left hand side a picture taken in May 2020 when there were time slots allocated for exercise, and a picture taken from the same location a month later when there were no time restrictions for exercise. Obviously, those time restrictions were there to prevent overcrowding, and unfortunately, this was exactly the consequence. So, if we look at this phenomenon from a behavioral psychology perspective, this is actually driven by the fear of missing out. If you only have until 10 a.m. to be outside, you just try to make the most of it until every minute, until the last minute. So, this is one example on how rules and restrictions fail. But also, apart from that, rules are sometimes hard to enforce. So let's take a very different example. For example, the poaching of wild animals. This is a very difficult problem to tackle because there's a huge market for that, and poachers are still willing to take the risk despite the punishment. And sadly, law enforcement can never be sufficient to prevent the poaching. So, what else, you may ask? What else can we do? What about education? What about raising awareness about and so on? So, education and awareness is something that works in a certain context and to a certain extent and can make a great impact. But there are situations in which we know that something is wrong and we still do that. So I was quite surprised in a recent research project, which was basically focused on how to manage chronic conditions like diabetes and hypertension. And I was interviewing a pre diabetic participant in the UK who had a huge family history. Pretty much most of his family had diabetes. He knew what he was supposed to eat and what not, and yet he did not do anything to prevent uh, the condition. Not only was he eating the most unhealthy foods you can imagine, but he hadn't even had a single medical check. So I was just wondering, how is that possible? Why is this behavior happening? What, how can we understand what drives it? So to be able to influence behavior, we first need to understand it. And this is where curiosity is the driver to find out what are the factors that influence behavior. Sometimes they might be less obvious than you might think. So I group them into two categories. We have factors, that encourage desired behavior, what we call motivators or enablers, and others that are preventing people from being their better self. And I call them barriers or inhibitors. So let's see a couple of examples of these motivators and barriers from a recent research project. So this is a research project that I did for an international client. It was focused on designing a service to encourage lifestyle improvement, and there was a particular focus on chronic disease was one aspect of that. And the idea was to have an in-depth understanding of behavior drivers and then come up with ideas of how positive behaviors can be supported. The project also included a co-creation sessions, which you can see a screenshot here, where participants, groups of patients were reflecting on their daily habits and also were coming up with ideas on potential support. So those kind of conversations are the ones that are a starting point to help us get an in-depth understanding of behavior, of human behavior. However, as most user researchers in this audience would probably know, is that we need to go beyond simple descriptions of behavior. So people tend to say something and actually do something different. And unfortunately, when we do remote research, it's quite difficult to combine that with observations, which we would do in when we carry out normal field work. So, what are the techniques we can use to actually get the information we need without, if we can't observe the actual behavior? One of the techniques is, for example, to ask people to talk about the past, storytelling, to tell you things, from the past and try to understand the associated emotions to get a better understanding what were the behavior drivers. So this is one approach. But you can also think of another approach, which would be to add some exercises to your interview, something that is a bit more playful, something that may kind of trigger an additional insight. So in this exercise, for example, we have a range of different activities and goals, let's say health and well-being goals that one could set for themselves, and they vary by time and frequency and so on. And this is kind of like a self reflection exercise with cards that a participant would drag and drop during the interview, and then have a conversation about why some goals are achievable and why some are not, and so on. So it just helps go deeper into those motivators and barriers that I was talking to you about earlier. So let's look at some of the insights that come up from these kind of techniques. Now, a very interesting one is about the power of guilt. That guilt is actually an inhibitor. Guilt is a barrier. So it may be something that is less obvious than other barriers, for example, the lack of time, family or work obligations, or having limited access to outdoors exercise. But guilt is quite powerful because it makes people give up when they try to adopt a new behavior, to introduce a new habit. So, like we see here, once I fail the first time, I fall off the wagon. I feel really so guilty that I just give up. And this is, things that are related to diet, exercise, and obviously, like improving your health, so to say. So, as designers, we can start to turn this understanding into an opportunity. What could we design that could tap into those guilty feelings, and maybe people could trade off their guilt for something positive. So this is what helps us, design solutions around, in order to kind of be able to encourage positive behaviors. Another interesting insight is the power of real-time data. So real-time data is something that is can be a powerful enabler. So in this example, you see a continuous glucose monitoring device. So diabetics use that, and it can show how the blood sugar changes based on particular foods they have consumed or after having exercise, and it's pretty reliable, and it's fast feedback on what is happening to your body. And interestingly, one of the participants said that he started eating less evening snacks because he realized how was those evening snacks were affecting his blood sugar. So this is one thing that a tool that basically helps us connect the dots. And this is something that is interesting as inspiration. And I want to basically wrap up this talk with a final example of how tools that give us this kind of real time information, like a glucose monitor, can be powerful behavior change tools. So what we see here is an experimental project called Crowd Free from TripAdvisor. I know it's still in an experimental phase. I can't say how reliable it is, but because unfortunately you only have data from United States, and as you can see, New York in this case. But the concept is quite powerful. It's supposed to show you how crowded a particular place is. And this is interesting because if we think about the earlier example of the crowded beach, we can start thinking, what if people had access to a tool like this? How would that have affected their behavior? And what if this was information that you could actually rely on and you could actually trust? How would that change your behavior? So I believe that we can encourage positive behaviors by designing honest, well structured tools that give us real time information we can act upon. And this is something that I want to leave with you to reflect upon what kind of tools could those be. So I hope this talk triggered your curiosity. And if you want to talk more about this topic, feel free to get in touch. Thank you very much for listening. Bye bye.